Hello and welcome back to Own Guard Solutions. Today I want to cover with you trauma kits, basic trauma. And this is not about first aid. First aid or boo-boo bags is not what we're going to cover in this class. You know, we're moving beyond band-aids and ointment and moleskin pads and things like that, antiseptic wipes, although those can certainly be part of your kit. I want to talk about basic, or I should say trauma kits to deal with basic trauma needs. And so what do I mean by basic trauma needs? I mean anything having to do with severe bleeding or severe hemorrhaging. Severe hemorrhaging is the #1 preventable cause of death in all trauma cases. So I have a few trauma kits that I've put together for various reasons. And if you have trauma kits, you'll likely have more than one as well. And so let's talk about a trauma kit for just a minute. So when I say trauma kit, I'm kind of differentiating it from basic first aid, obviously. And with that being said, some folks put everything into the same bag and call it their first aid bag. Call it a trauma kit, a first aid bag, first aid kit, or a medic bag, a medic kit. But we want to differentiate first aid kits or a boo-boo bag from a trauma kit or a blowout bag. And again, I'm having a hard time talking for you today. Forgive me. But at any rate, we're talking about specifically trauma kits or blowout bags. And so I assembled a few that I have, and yes, I have many, but there's a good reason for that, is because you need to ideally have first aid and or trauma on hand in places where you can get to them effectively when you need them. And so I brought out a few here as examples, and we're going to open up one of these random today, and it's not really random. I decided before this video which one to open and kind of show you the contents that I carry in a basic trauma kit, one of my basic trauma kits. But I kind of want to walk you through those that I have and where I keep them and why. And then we're going to open one. I'm going to show you what's inside, why I have it, and then we're going to talk about possibly some other supplies to consider having in your trauma kit. So with that, let's get started. So as you can see here, I have a quite, oh, wait. Hello. Did you want an up front seat or something here today? So for those of you that have watched some of our other videos, you know that this guy right here shows up in most all of them in some shape, form, or fashion, and today is no exception. This is my Balian warrior. I think technically he's supposed to be a guardian. He makes me feel safer, but he's a bit in the way, so I'm going to move him over here to the side a little bit and hope that he stays out of the way, whatever. So the first one that I want to show you, and we'll kind of talk about the setup and where I keep these. This one is actually a trauma kit that I keep in my house. I actually keep it in my washer and dryer room. I keep it in there because it's sort of centrally located. I know exactly what shelf it's on in there. My thinking is that if I need a trauma kit, it's likely going to be while I'm working out in the yard, mowing grass, whatever, something's gone awry. And so this is the bag that I keep in my washer dryer room. I don't have a fancy pants mud room, so for me it's just my washer and dryer room, and I'll let you guess why I call it that. But this bag is super nice. It's very small and compact. The things that I like about it are that it allows me to have a tourniquet outside the bag, which means faster access. Of course, I have this particular bag set up with a pair of nitrile gloves, light blue nitrile gloves outside the bag. I have my shears, and I have a Sharpie pen back here for marking the time on the tourniquet if I ever need it. But the thing that I like about this bag is that while it has zippers on the other side of it, it allows for tearing open down the front with Velcro, being held closed by Velcro, and it just allows you to open up very quickly to get to its contents. So because it's compact, because it's a quick access, because it allows a tourniquet to be stored on the outside, or at least that's what I've opted to do with it, I like it. What I don't like about this bag is, ironically, one of the same reasons I like it is it's almost too compact. And so it's fine if you have Z-folded gauze, whether it's hemostatic or not, or S-folded, whatever you have, and those items, you know, being better suited for more compact spaces. But man, if you got a lot of bulky rolls of gauze or otherwise, the space inside this thing gets consumed quickly. So you got to find a balance in what works for you. But this is my home kit, and I've got some goodies in here, but this is not the bag I want to show you today. I'm going to kind of bring out these next two at the same time because I keep them in the same place, and that's my vehicles. Ideally, you should keep at least one trauma kit, aka first aid, if that's what you're going to keep, to have everything together in the same bag at the same place. But I keep 2 trauma kits in my car. Why? Well, it's extra. It's extra of everything inside of them. There's going to be at least 2 tourniquets between the 2 of them. And so similar sorts of setups between the 2. I have shears on the outside. In the case of this one, gloves on the outside. They're both designated with a first aid cross, just to make it obvious what they are and what their purpose is. And we're actually going to do a deep dive into this one. This one I actually keep in this bag in my trunk so I can grab and go if I need to. And this bag usually has everything that this bag has in it and more, but I keep it in this bag, which I keep in my trunk. This trauma kit bag I actually keep in the floorboard of my back seat. Why the floorboard? In my mind, if I'm in an accident, I want less things flying around my car, like bullets. If I'm in an accident of some sort, and everything loose in your car can become a projectile if you're in an accident, if you're in a car wreck. So I keep this one in the floorboard, but there's other places to store it, including racks on the back of your seats or on the back of the headrest. We'll talk about that potentially in another video. But I have 2 in my car. Again, more gear. The merrier, I say. And this is the one that we're going to do a deep dive on here coming up. I have a trauma kit, and this one is truly 100% trauma. This is super nice. It's a little larger, as you can see, compared to the couple others that I just showed you. So there's a lot more room in here by comparison. It's still somewhat compact. It's still designated first aid, trauma. You know, you can tell looking at it, it has a purpose. You can tell by its red color. I really like the red, it stands out. And I keep this one attached to my range bag that I take shooting with me at the gun range. And the nice thing about it is the way it mounts, and I don't have that today to show you, but the way it mounts, there's some straps on the front of my range bag. And then between the straps and this Velcro, I should say hook and latch on the back, it allows me to attach it to the front of my range bag, and then I can quickly grab it and tear it right off of my range bag and get access to it. And it has everything that I might need at the range, including tourniquets and gauze. You know, again, we're talking basic trauma kits that have some specific supplies, medical supplies in them that we're about to get into in a moment. So we've talked about these. And then last is a kit that I carry. This is the kit that I carry, suffice it to say, when I travel, when I'm on the road, when I spend some time on the road, or I go to visit my parents, whatever. This bag to me is even more thorough than these other bags. It's kind of my primary go-to trauma kit, just the way that I've set things up. And as if maybe you can tell already, I have it inside of a dry bag. I carry this in a sling bag, a medium-sized sling bag. I actually have this trauma kit along with some first aid, a first aid kit inside of it, as well as some medication. Again, we're not going to really talk about first aid and medication today, although we can get at that later. And by medication, I mean basically OTC stuff that we all have access to, over-the-counter stuff. It's not like I'm some doctor or anything, but for me personally, I built out this medium-sized sling bag to have a lot more stuff in it than I would need than I have in some of my others, so this is one as well. So, you know, it seems like a lot. It's 5 different bags. The contents of each varies a little, but it's still basically the same. And of course, as I mentioned, this one is the most complete. Something to keep in mind as you're putting together these trauma kits, regardless of what you might have seen online or read or what videos you watched, is you want to get some training so you know what you're doing. And then it's very important that you don't operate beyond your training space. So with that being said, you know, all of these bags for me kind of provide me gear that allow me to operate within the space of training that I've had. So that's an important item to note. And the other thing that I want to say about all of your medical supplies, whether you're thinking about just basic first aid or basic trauma, is that most of the medical supplies have expiration dates. So you want to get in the habit, I would say, of inspecting all of your bags and all of your gear probably once a year, just to make sure something hasn't expired or isn't too far beyond expiration. And if you keep trauma kits like I do in your car, something to keep in mind is while they have expiration dates, the heat and the temperature changes in your car can really impact the longevity of the gear. You know, whether it's rubber, plastic, elastic, those sorts of things can be adversely affected by heat. So if you do keep a trauma kit in your car, which you should, you just want to keep that one checked a little bit more frequently. But certainly you want to look across all of them every year, every 12 months, give or take, to make sure everything is as fresh as it needs to be. And so I think I've covered all of that I can, talking about these individuals and why I have so many and their purpose and their place. And it's important to have them. You need as many as you need for you and or your family. But it's important you have them in the right places, like your home, your vehicles, maybe if you shoot a lot for the range like I've showed you. It's important to have them where you need them so that you have them when you need them. It doesn't do you any good if you only have one at home and it's not in your vehicle, or something happens at the firing range and you don't have the one that you keep in the washer dryer room at home on you. So that's why I have so many. Each one has its place and therefore kind of serves its purpose. So ideally, if I ever have to have these, I have them available where and when I need them. So we're going to get started. I told you that I had picked one out by random, aka intentionally picked this one. There's no particular reason why I picked this one other than maybe I felt like it had a good sampling of things that you should consider carrying in your basic trauma kit. So this is a very small bag. I think this is made by Condor. I'm not 100% certain, but you know, it has some moly straps on the front and on the back. You can attach this potentially to the headrest in your car. Again, I keep this one currently in my floorboard in the back. And so opening it up, if I don't drop everything in the floor, just in no particular order, the first thing I have is a tourniquet, as I hope you would imagine I would have, and I do. In the spirit of transparency, I only have one tourniquet in this particular bag, but between the bags that I keep in my vehicle, which this is one of, I have more than one tourniquet that hopefully I won't need to get to, but I could if I did need to, one way or the other. But it has a tourniquet. We'll talk more about these here in a minute. It has some rolls of gauze. These happen to be, I think, 4.5 inches wide by, I don't know why they do this, but 4.1 yards. I'm sure it's because somebody along the way converted from metric to, what's the word? Imperial. Sorry, I blanked out there for a minute, but this is 4.5 inches by 4.1 yards. A lot of this sterile. You want to have ideally sterile gauze on hand. The rolls are fantastic because they can be used for a lot of different things that you might need. They can be used for an arm sling rest if need be. You can use it to stuff a wound if you need to. You can use it just as one big gauze pad on top of a wound that's bleeding, that you're having difficulty stopping. You can use it to wrap wounds and keep, once you get some gauze pads on a wound, you can use it to wrap that up. And based on how you use that gauze, you can actually use gauze rolls to add some degree of compression to a wound, and we'll talk about that in future videos as well. But having some sterile gauze on hand is definitely key. And why sterile? So the difference between, and it's sterile as long as the packaging hasn't been torn or punctured. Once the air is introduced, it's no longer sterile, but that's okay, because if you're desperate to deal with severe bleeding, you can use sterile or non-sterile gauze. It doesn't matter. Let the miracle of pharmaceutical chemistry, once you get to the hospital, let them deal with any infection or bacteria with antibiotics. That's the miracle of drugs. But ideally, you want to deal with, have sterile on hand. The reason why I don't worry about having non-sterile gauze on hand in my trauma kits is because trauma kits are meant for the injury immediately after they've happened, not after they've healed. And so having sterile gauze is preferred. The reason being is, I think of it as, and the way that I was taught is that sterile is for wet wounds, meaning they're bleeding, they haven't healed, obviously, they're bleeding, they're oozing, they're pussing, whatever, you want to have sterile gauze. Once they begin to heal and they've sealed up a bit and they're no longer oozing or bleeding or producing, discharge of any sort, you can move to non-sterile gauze, and that's okay, generally speaking. But in your trauma kits, you want to have sterile. The next thing I have, which is almost all-encompassing, is one of these quick clot trauma packs. It doesn't hurt. If you had nothing else, throw one of these in your vehicle. Keep one of these at the house, at least one of these in the house. And ideally you should have one for every individual in your home. But these are nice because they almost contain everything you would need. They even have gloves. They have hemostatic gauze in them. Let's see here. Trauma pads. They even have duct tape in them sometimes. A triangular bandage. Sterile 4x4 gauze pads. 2x2 sterile gauze pads. I mean, they have a lot of stuff, even some antiseptic for cuts and scrapes. These are fantastic, and you just tear them open and you got everything you need. A couple of things they don't have that you'd want for severe bleeding is shears, and you don't have to have shears, but it certainly makes moving the clothing out of the way so you can find the bleeding a lot easier. They don't have shears, and obviously they don't have a tourniquet, but this is a great quick down and dirty choice for having something beyond your basic first aid and band-aids, right? One of the things that I absolutely love, and I keep a couple of different sizes in this kit, is the Israeli bandage. I love these things. I love these things. I love these things. Why? They're packed sterilely. They have an outside package as well as an inside. You may want to consider taking off this gray or whatever color they're going to be. There's more than one brand and type of this bandage, but you may want to consider taking this off just so you have only one package to get through instead of two. You want to be careful not to puncture all the way through, because that would make it no longer sterile. The other reason why I personally haven't removed the outer packaging is because this outer packaging, if you don't have any, makes a great makeshift chest seal potentially. If you've got some medical tape or otherwise, the outside packaging can be used as a chest seal. We won't get into that today, but you may prefer, especially if you don't or are not comfortable with chest seals, you may prefer just to take this outside case off so it only has the inside, and the inside is just a vacuum sealed sterile clear case for these. We'll talk about these in the future because I want you to see how an Israeli bandage is applied and works. It's so cool. They typically make a couple of different sizes, both 4-inch and 6-inch usually is what you'll find. They may have others, but those are the two that I see and have gotten for myself. These are fantastic to have in any kit. This is, as I mentioned, this is an example of some S-folded gauze. This is not hemostatic, but it is very compact. Why is it compact? Because it's S-rolled and because it's vacuum sealed. So when you're dealing with smaller trauma kits or kits that you've turned into your trauma kit, it takes up less room, right? It's not as big and bulky as a rolled piece of normal gauze. So something like this, and they make Z-fold too that we'll talk about here in a minute, but this is an alternative. Now, I'll go ahead and bring up the Z-fold. These are very compact because the Z-fold takes up a lot less room. The way they folded it, it's not rolled obviously, very thin package. Same with the S package. This just makes it so much easier to pack and have the right gear in a very confined space. So we've got that, and we'll talk more about that here in a minute. A couple of other things is that I have some 4x4 gauze pads in my bag, not sponges. You'll see a lot of sponges out there. Sponges serve a different purpose than what we're typically dealing with in basic trauma care, and we can cover that in a future video as well. Lots of future videos already here being planned for you. That's great. But having some sterile gauze pads in place can serve a lot of purposes. Again, it's all about getting that bleeding stopped through compression or the use of tourniquets if things have gotten really bad and you can't get it stopped by using gauze like this and applying pressure. But having some gauze pads, as I mentioned earlier, chest seals serve their purpose as well, and you know, it doesn't hurt to have some of these for gunshot wounds or otherwise. Here for the thorax, torso area. All these things have their place, right? If you're using a tourniquet, you're talking about the extremities, like your arms and your legs. If you're talking about packing a wound or stuffing a wound, you're talking about junctions like here or in your hip area, you know, where you just can't easily get a tourniquet to. Your neck, even your face could be stuffed. You don't want to stuff here because there's likely nothing you can do to get the bleeding stopped in these spaces in the thorax and whatnot. But think about tourniquets for extremities, thinking about stuffing wounds for the junctions. Not that you can't stuff an extremity either, but primarily think about junctions for stuffing, and then you know, compression everywhere, right? Just a couple of first aid-y things that I do happen to keep in this particular bag is, you know, you can't have too many Band-Aids on hand, so I keep some Band-Aids in this trauma kit just in case. And then I learned a long time ago that if you keep one of these little tubes of cake icing in your bags, it could help a diabetic if they're having an episode. So I keep some cake icing in here as well. And again, I keep this in my bag so I can grab it and not just be for me, but you know, a perfectly good stranger that's in need of help, which is the kind of the mode that I operate in. Like, I can do these things for myself or a loved one if they're with me, or a friend if they're with me, but I'm also thinking about my fellow man as well. I think last but not least, yes, it's last in this particular case, is I keep a 1 to 2, big enough size for 1 to 2 people. I think this, and you don't have to have this brand, but I think this particular one supports up to 2 people. Yeah, it's a good size emergency blanket. And I keep this in here because if you go through the March assessment, which is an acronym, the H in March is for hypothermia, which can be a real issue. And it doesn't have to be super cold for hypothermia to rear its ugly head. H is for hypothermia and head injuries, but obviously a blanket's not going to do anything for head injuries. But your patients, whoever that may be, especially if it's cold out, but really at any point, loss of a lot of blood, shock, those sorts of things, you want to keep them warm, and an emergency blanket is a fantastic way of doing that. Pre-hospital, and everything we're talking about here is pre-hospital. In other words, you're first on scene, or you were already there because you're with whoever, doing whatever with them. You're waiting on first responders to come on scene to take over, to administer more advanced care, and most importantly, get a severely injured individual to the hospital where they can be cared for properly. So what I've just showed you is inside just this one clamshell type of bag that I keep currently in the floorboard of my car. Normally it might be mounted to the back of my headrest. Right now it's just in the back floor space on the floorboard. What else can we show you? We've talked about the gauze. We've talked about chest seals. There's a couple of big brands of chest seals out there. High Fin being another one. They typically come in 2 packs. The thought process behind that is because if it's a gunshot wound, it could, or GSW for some of you, it could be through and through. You know, they got shot in the back, came through the front, or they got shot in the front, went through the back. You'll need to have 2 of these for either case. There are options as far as space conservation and then dealing with severe bleeding. We've talked a lot about plain gauze, but the other option that you have, which is typically quite a bit more expensive, is gauze that's been treated with some sort of hemostatic agent. In the trauma pack from Quick Clot, you'll find gauze that has been treated with a hemostatic agent, usually. And then there's things like the Celox combat gauze, the Quick Clot we've talked about, and there's another brand that's completely slipping my mind right now. But hemostatic gauze is a fantastic option. You don't have to have it, especially if you're on a budget, and I realize this medical gear can get expensive and the pricing can get out of hand. So for those of us on a budget, some of the time at least, just some sterile rolls of gauze will do you right, and the pads, just know that it's going to take up more space. If you want to spend a bit more money, you can get some of these S-folds or Z-folded gauzes, and for a little bit more money even, you can get some with the hemostatic agents. There's a couple of few hemostatic agents that you'll typically see out there, but just another thing, as long as the compression, which is the most important piece of dealing with severe bleeding, As long as the compression is there, the hemostatic gauze can cause clotting, blood clotting, sooner and faster than just regular gauze, but it is going to cost a bit more, but something to consider. They also make gauze made primarily for stuffing a wound, like a gunshot wound or a puncture wound, something of that fact, that has basically a radioactive strip. That sounds horrible, but that's what it is at the end of the day, a radioactive stripe down the middle of it, so that you know, you don't have to worry about gauze getting stitched up inside of someone, because the radioactive stripe will show up on x-rays. They make some of that stuff. Just a couple additional points. I'm trying to see here if there's anything else that I want to talk to you specifically about. Just a couple of things real quick. I want to talk about lighting sources. You can't rely on the worst of the worst things happening in broad daylight, right? So just a few light source options to talk through. This is a Princeton Tech small light that you squeeze if I don't have it turned off, or maybe it's already burned out about, oh, you just can't see it because it's light in here, but you can keep one of these in your kits. Provides a little bit of light. Of course, it is very small, so you might lose it. Requires some fine motor skills, so if you're under stress, you know, just a couple of things to think about, but nonetheless, you probably want to consider having some sort of light source in your kits or nearby. Of course, we've written about this, and we've written about trauma kits in some blog posts and talked about them in our podcast as well. But another thing that I keep on me quite a bit is some sort of flashlight, and it doesn't have to be a tactical black flashlight, but having a flashlight in one of your kits or in your car. You probably have them in your house, but if not, you should have them. You should keep one of these in your trauma kits, or certainly have it in your vehicles. Great to have so you can see what you're doing. But the drawback to these is they do have batteries, right? And eventually batteries burn out. Even rechargeables will lose their charge over time. So we've talked about in an article, one of our blog posts, we've also talked about considering having glow sticks on hand. These things are fantastic, and believe it or not, one glow stick puts out a fair amount of light. Now you might want to have more than one on hand, but take this thing out of the wrapper, snap it. This one happens to be called a snap light, and rightfully so. When you snap them in your hands, it breaks a tube on the inside that allows the chemical in that inner tube to mix with the chemical just inside surrounding that inner tube, and the two chemicals combining allow this thing to glow. And then if you shake it up, it just gets that much brighter. Really great to have on hand for a lot of different reasons, but certainly dealing with a trauma situation on the side of the road, for example, in the dark, or anywhere in the dark is not a bad idea. And so these are great, and they don't rely on batteries. So that's kind of the light part of it. Just want to circle back to tourniquets for a minute, and we'll definitely be doing a video, at least one video, on types of tourniquets, application of tourniquets, etc., in the future. Today we won't do a deep dive, but I will give you a couple of pointers, a few pointers in fact, that ideally you want to have a minimum of 2 tourniquets per person in your family. And you say, well, why is that? And that gets expensive. It's because you don't know what kind of injuries they may get when and if, and hopefully they never will, but when and if they are hurt, you'll never know what kind of injuries they will have. You may have to put a tourniquet on their leg and one on their arm. The first tourniquet that you apply may not do its job, and you need to put on a second tourniquet above that first tourniquet. So there's a lot of reasons to have more than one tourniquet on hand per person. So I recommend a minimum of 2 per person. I'm going to follow that up to talk about pricing a little bit for the minute. This happens to be a North American Rescue cat tourniquet. I think this is a Gen 5, although I'm not 100%. A good, excuse me, good cat tourniquet is going to cost you, I will say, and you can get all this gear off of Amazon or similar. A good North American Rescue cat tourniquet is going to run you in the neighborhood of, I'll say, $32 to $36 a piece. And yes, they're just that expensive. Any official tourniquet, any name brand of tourniquet is going to run in that price range. There's no way around it. Yes, can you buy cheap knockoff Chinese made tourniquets that look like this but are not for less? Yes, you can buy a 2-pack that look like this for as little as under $14, a 2-pack. But you do not, repeat, do not want to do that. If it's not $30+ and a name brand, you don't want it. Why? Because when you need to use it and you go to apply it, they will break. And yes, I've broken at least one in training, because in training it doesn't matter what tourniquet you have, as long as you got something to apply. And I will tell you with firsthand knowledge that the cheap knockoff, no name Chinese tourniquets will snap on you. And when you're trying to get severe hemorrhaging under control, the last thing you want is your tourniquet to fail on you. So spend the money. And yes, I know it costs a bit, but this is your friend in times of need. Now, with that being said, compression should generally still be your go-to for dealing with severe bleeding. You know, so your sterile gauze is going to be your friend. And that compression, the most important piece is the compression. But tourniquets have their place. If they're left on for too long, there can be issues with them. But if you apply them correctly, which is why I recommend getting training for any of this stuff we're talking about, if you apply them correctly and things are managed in the allowable time frame, they are completely a right choice for dealing with hemorrhaging, bad hemorrhaging. We're talking about stuff that you can't get stopped with the gauze, for example. The other thing that I want to tell you is about prep. When you get your tourniquet, and the tourniquets for you to use are generally black, you'll also find them orange, and you can find them red, like the American Red Cross has their tourniquets red, and you can imagine why, right? That's kind of their color. The orange is also viable, and the orange is used because the theory behind the orange is it's bright and it's very obvious and easy to find a tourniquet that's been applied. And of course, black to me seems the most common. The other color that you'll find or see will be blue, but blue's not typically what you use in an incident if you needed a tourniquet. Although if it was a brand new blue tourniquet, you could, but blue basically is for training. And the differentiation between training and a tourniquet that you keep in your kit for use is different, because training tourniquets are meant for reuse. So they're used multiple times, as you can imagine, because you're using them in training classes. And so a blue tourniquet is typically going to get used multiple times, a lot of times. And the one thing that you don't want to do with a tourniquet that's for real use is use it more than once. A, it's probably going to get bloody and nasty. And B, because they're generally got, they generally have hook and loop. They're elastic in some cases, or, have elasticity associated with them. They will wear down. And if a tourniquet's worn out when you go to use it, it's not going to do you any good. So if you're going to use a tourniquet for purpose, it needs to be brand new and not a trainer, because again, the trainers are meant for reuse. And the other thing you want to keep in mind is your tourniquets, when you buy them and they come to you, they're going to be wrapped in a package, and they're going to have a set of instructions inside that shrink wrap. It's basically clear shrink wrap. go ahead and tear it off before you put the tourniquet in your kit, because time is of the essence, and you just want to have them ready to go sooner than later, faster than not. So that's all I'll say about that. Again, a minimum of 2. There's some approved tourniquets for use that have gone through the process and paid the money to be approved for use. There's all sorts of tourniquets on the market, and we'll cover some of those in a future video. I have traditionally stuck with the North American Rescue cats, but there's some other solid options that just happen to be similar to the cat, but not. We'll talk about those. And then so I have all my trauma kits. The one thing I failed to mention is, for the last year since I've learned about it, is I actually keep a tourniquet in my pocket when I leave the house. Not because I'm paranoid, but because I'd rather be prepared, which is why I have all this stuff in the first place, than not. This is a tourniquet that is from a company called Snake Staff Systems. I'm not affiliated with them, I'm not getting paid, but I'm going to mention this because I learned about it about a year ago when I went through my TCCC training. Some of the guys there, some of the docs and medics there were carrying them, and now I understand why. And it's inside of a sleeve, and I'm not going to pull it out, but it also has a windlass. It has a place to lock in the windlass once you have it tightened up. It's actually in a sleeve, so that you can thread this sleeve through your belt, thread it through your belt, or your belt through here to put it on your belt line. But because it's such a compact tourniquet, I actually carry it in my front pocket when I leave. So even things like this are options. They're just not necessarily approved formally for use, but a solid option nonetheless. So again, find what works for you. Have enough tourniquet or enough trauma kits to cover you and the people that you live with. Certainly have at least 1 tourniquet per person that you're dealing with, if not 2, ideally. Keep them in places where it makes sense for you. The house and the vehicles are 2 places that you definitely should have a basic trauma kit. If you shoot a lot like I do, 1 for the range is not bad, and then, you know, beyond that, there's reasons to have even more. But hopefully today we've given you a good smattering of where and how and why you should have trauma kits, and the gear that you should consider keeping inside those trauma kits. If you've liked what you've seen here today, please be sure to like this video, subscribe to our channel so we can keep you up to date. Again, we're going to be doing more trauma related and or first aid related videos in the future, so subscribe to stay updated with those and all the other videos we're doing. Thank you so much for watching us today. We greatly appreciate it, and we'll see you soon.